Just had ACL surgery and wondering what's normal and what's not. Swelling, clicking, weakness. Well, in today's video, let's clear this up. Some things are to be expected, but some are big red flags. ACL rehab can feel confusing, as I'm sure you all know. It's even worse when no one tells you what's actually normal and what's not normal. So let's break it down properly with none of the fluff and straight facts. Number one, swelling that lingers. That is not normal. Swelling should start to go down gradually pretty early on in the rehab. If you're still swollen weeks later, that's not normal. Something's off. I can have most of my patients with little to no swelling by 8 weeks. Here's what you need to do if your swelling is just coming, going, or just staying and not changing. First thing, check your step count. You might be doing too many steps too soon. Check it and start to track it on a daily basis, and then understand, is swelling coming, going, are the steps too much? Are you doing enough exercises? Yes, some people just do nothing all day and swelling won't go away on its own. You need to elevate and rest, but you also need to actually exercise and move the knee. Are you doing the wrong exercises? It could just be that you're doing exercises that are not progressive enough or not challenging enough. It could be a number of things, but make sure you're doing the right exercises. Start to track your swelling, so measure around the circumference of the knee, even take photos if you have to, just to ensure that you can actually measure and monitor the swelling. The knee is giving you a signal, so we need to listen to it, and swelling is one of those big ones that something's not right or the knee's simply not happy. Lack of extension, this one drives me round the bend. Not normal. I've said it so many times. Don't rest or sleep with a pillow under your knee, and yet people still ask me why. It's simple. If your knee is bent, it's bent. That's all there is to it. Resting like that puts you at risk of losing extension and also just creating a poor resting, pattern. Once you lose extension and you just don't get it back day after day after day, it then becomes quite difficult to get back. No excuses. You must get full knee extension. I say to my patients, we are not going to negotiate about getting extension. We're just going to have it and we're not going to lose it. What most people don't realise is that right before you are woken up after surgery, the surgeon will straighten your knee and they'll get full flexion, okay? When you wake up, literally you've just come round from anaesthetic, your knee is straight. So we must try to keep it straight. We don't want to lose it. I still see now post-op patients whose therapists are just forcing the knee, 4 weeks, 8 weeks, 3 months. Each session looks the same. We're not doing anything to build muscle or recruit the quads that's actually going to help us. All we're doing is jamming the knee into extension. It really doesn't have to be that way, so don't let that be you. Even now, therapists comment on my Instagram when I say, stop forcing the knee straight, stop forcing extension. They say, how are we meant to get it straight? I mean, basic anatomy, we're taught very early that if you squeeze your quads, it will aid extension and the knee will go straight. So just wake the quads up gradually, day by day, set by set, keep chipping away. You can't just keep forcing somebody's knee straight, like it's painful, it's monotonous, and the longer you do that, the quads are then not actually going to work and do it for us. On to the next one, clicking, clunking noises. This one is semi-normal, okay, because after surgery, your knee isn't exactly how it used to be. It's not like changing a tyre on your car, you get a like for like, it's all fine. The graft is a bit bigger than probably your native ACL. So it's normal to get some strange noises, and I have heard some strange noises as well. Some clicks, some clunks and little cracks. That can be totally normal, as long as there's no pain. When we get pain and swelling that's associated with those noises, i.e. it's hurting, that's different, and that's when we would need to check it, especially if you've had a meniscal repair and all of a sudden your knee's starting to make like a clunking. I would certainly want to know where that clunking's coming from. Is it patellofemoral? Is it the meniscus? And then possibly something happened to that meniscus. Won't go off on a tangent. The next topic is weakness. This is normal but fixable. It's normal for your knee to feel weak. That's totally normal. You've had major surgery, your body's been through a lot of trauma, and now you've got to build everything back up again. It's the same as if somebody broke their arm and was in a cast. They come out and they go, oh, it feels really weak. It feels like a matchstick. This is exactly the same. So treat it that way. We've got to build the muscles up gradually, and then your knee should start to feel, normal. It shouldn't feel unstable. If somebody reports instability to me, I'm a little bit more concerned. If it feels wobbly, I'm not too happy. But if it just feels weak, that's fine. So put the work in to get those muscles back, and you should notice a big improvement in terms of that weakness and a strength deficit. Developing secondary issues is not normal. This is one that really does drive me mad in clinic, because I see lots of second opinions for this where it's just unnecessary. Here's what really shouldn't happen, and I'm seeing more and more in my clinic, and I feel like I really shouldn't be. So I see as a common complication post ACL rehab, and it shouldn't be common, by the way, it shouldn't be normal. I can't reiterate that enough. Fat pad impingements, chronic strength deficits, tendon pain at graft sites, and these are rehab caused issues. Sometimes you might get the knee might get a bit of aggravation, you might get a bit of anterior knee pain or the graft site if you've done too much too soon, but generally speaking, they don't come from the surgery, they come from poor management afterwards. No ACL rehab should cause secondary problems, and I'm sure lots of therapists will kick off at me saying that, but I'm not here to, I'm here to spout the facts, because I'm the one picking it up and dealing with the pieces. But let me put it in a different way, right? Imagine taking your car to a mechanic, they fix one thing, but they break something else. You'd be like, what am I paying for? You've fixed one thing, but you've actually broken something else, and now you've got to pay them to fix it again. Your body is literally no different, so view it that way. You can get little aches and niggles and pains from, the body getting used to adaptation and load, but you shouldn't be developing like back pain, Achilles tendinopathy, and all those kinds of things that I see. You're trusting somebody to help you heal and fix those problems, not leave you with new issues, okay? That's why we take a very good clinical history to understand what issues you've had before and what, things you're more prone to getting, and then we avoid that and build the rehab around it. So what's normal what's normal after ACL surgery? Let's end with a little bit of reassurance and on a positive note. So what can feel normal? Feeling a little bit awkward when you're walking early on. Your knee might just feel a bit like you're not sure where it is. You might not have any spatial awareness. So that's normal. At the end of the day, you can find that your knee just gets a bit tired and a little bit achy. Temporary muscle loss, so your muscle just wasting away, but you start to notice it coming back quite quickly. Weird sensation, particularly around the knees, around the scars as the nerves are kind of healing. Finally, needing guidance and lots of check-ins, or a proper plan, something that you can actually see and measure your progress on, because ACL rehab isn't actually about time. You shouldn't be doing X by X weeks or X months. It's actually about when you're ready to progress. So you should have a testing data and these numbers that say, okay, Tilly, this is where your knee is, this is where we want you to be, and we predict that you'll be there within the next 4 weeks, providing that you do really well in the gym, and then once we've ticked that off, this is what we're doing for the next step. So almost imagine it as having stepping stones, so that you've got a very progressive overview and a plan, just like what's in the complete ACL recovery guide, where you can actually follow and see where you're heading and what it is that you're aiming to do within your ACL rehab. I made this video today because I see way too many people in clinic questioning themselves, have I done something wrong? Is it my fault? When really, majority of the time, it's the rehab that's actually let them down, or just lack of expectation setting. So patients have gone off, done this, this and this, and actually they weren't ready to do that, and the therapist should have made it crystal clear that they're not ready to do things like that, in my opinion anyway. But if you're not sure whether something's normal or your rehab feels all over the place, you're just not getting the progressive overload that you think you need, or actually you're not testing, you don't know where you're at, you're just doing this plan aimlessly, you're turning up each week and just repeating without seeing any kind of progress, I've put all of my information from the years that I've practiced into my ACL recovery guide. It walks you through basically ACL rehab step by step. Rehab shouldn't feel like guesswork, and I don't want anybody to feel like they're guessing through ACL rehab, and I made the complete ACL recovery guide for this very reason, but also because I'm too busy to help everybody. It's £89. I'll pop the link in the description area so that you can have a little look, check it out, see the reviews, see the people that's having the success that's using it. Drop a comment with what just how you're doing post-op, and I'll maybe try to help you, point you in the right direction and just say that sounds normal, that doesn't sound normal, let's have a look, etc. I hope you found this video helpful. If you did, please like and subscribe, and hopefully I'll see you in the next one.